cancer itself is a group of diseases, or it is one disease that is normally characterized by abnormal growth of cells in the body, that is unwanted extra growth of cells which outcompete the body and then eventually develop into cancer. It is a burden for our health structure and for our population, and with that big number annually, definitely you can tell that we really have challenges. That's a very good question. So cancer can attack any organ in the body, and with our structural makeup, it can go to the brain, it can go to the genital organs, to the liver, to the kidneys, to the lungs. And the most common ones, as we see in Rwanda, is we have breast cancer for women, we have cervical and uterus cancer still for women. We do have a couple of, a small percentage of men that get breast cancer. We have prostate cancer, which is definitely very common in men. And then we also have HIV-related cancers, normally called lymphomas, and those are the blood cancers, and they're also common. So the breast, the prostate, and without forgetting the lung cancers as well. There's two ways we can divide depending on the causes of cancer. One is genetic causes, that is inheriting part of the genetic cells from your parents or from your grandparents who have had cancer. So you inherit those cancer cells that later grow into your body. The other one is environmental, what we eat, smoking, alcohol, all those trigger cancer. We do realize people come in their late stages to the health facilities, and the reason is they do not feel the symptoms before. The only way to feel that cancer is on or you have cancer is checkup, regular checkups. We encourage annual, like every year, every person should know their checkup. We do that here in Legacy. Otherwise, there's lots of weight. There's definitely developing unnecessary nodules everywhere in the body, and we do see a lot of people with those signs in the late stages of cancer. So any other sign can manifest in cancer. It is preventable. Number one, as I said, if we signal that you have a high risk of getting it from the family, which is the genetic inheritance, and we do the routine checkup, we can detect it in early phases. Besides that, the preventive measures is taking care of your good health. Smoking, as I said, is a high risk of getting lung cancer. Alcohol causes liver cancer, which manifests in other organs. Infections, most especially, as I said, HIV. There's also a virus women normally get for the cervix, which causes cervical cancer. So all those, if you prevent protected sex, definitely is one of the major preventive measures. In rich people, well, there's no significant data to show that, but definitely we can. Number one, we could say maybe the diagnostic processes are very good compared to ours. And the other thing is they live quite artificial lives, like everything, like decongested food, refrigerated foods. They don't have the natural foods like we have here. So although they smoke, they drink alcohol and liquors, all those are very, very heavy risk factors. Yeah. It is very treatable, and we have a very good outcome for patients that come in early phases. So the treatment is divided in three. We, after diagnosing and finding out that you have cancer, we do give you chemotherapy, we treat you with radiation that's burning the cancer cells and definitely taking out that collection of cancer cell tumors. So surgery is also what I'm speaking about. Now, Legacy does not have a theater for now to do the operations, apart from the screening, but we have a cancer center in Rwanda Military Hospital, where all those three options are available. So there is a collective, definitely treatment option in